Hello everyone, my name is Donna Kerr. I'm an accredited mental health social worker. I'm going to introduce you today to the eye movement desensitization reprocessing therapy model. At Zest, I use EMDR, or eye movement desensitization reprocessing approaches in therapy, and I am EMDR level 2 trained. Found in practice, EMDR psychotherapy approaches complement other evidence-based mental health strategies such as CBT and mindfulness and ACT. The most significant impact I've noticed during my treatment sessions is it prepares and assists clients to build self-awareness, build emotional resilience, improve tolerances with reduced intensity of persistent negative memories about a particular issue or memory to a more tolerable level. EMDR aims to foster adaptive healing, promoting safe recovery from trauma and other mental health concerns, and for personal growth. Just a little bit about understanding EMDR therapy. And its origins. The mind can often heal itself naturally in the same way as the body does. Much of this natural coping mechanism occurs during sleep, particularly during rapid eye movement sleep or REM sleep. Francine Shapiro developed the EMDR model in 1987, utilizing this natural process in order to successfully treat post-traumatic stress disorder. Since then, EMDR has evolved and has been used to effectively treat a wide range of mental health conditions. I'm just going to share with you functions of the brain and how trauma affects the brain. So just on the left-hand side of the screen, you can see we've got the prefrontal cortex, the most advanced part of the brain, serves for executive functioning, inhibiting unnecessary stress responses. Brainstem, primitive area of the brain, regulates essential functions like your heart rate and breathing and sleep, keeps your body's automatic systems in place, triggers the fight, flight, or freeze response when there's a threat, returning to baseline once a threat passes. The limbic system is in charge of memories and emotions. The amygdala scans for danger and triggers the body's defense mechanisms only when there is a clear threat. The hippocampus organizes memories, helping you store and recall events in a coherent and chronological way. That's when the brain is functioning normally. So when you have trauma, the prefrontal cortex, the amygdala, and the hippocampus areas are impacted. So the prefrontal cortex, where there's rational thinking and your emotions are regulated, such as fear responses, the brain has a reduced volume. The prefrontal cortex has a reduced volume. Therefore, you may become more emotionally dysregulated or triggered more easily. The hippocampus is responsible for memory and differentiating between past and present. It works to remember and make sense of the trauma. With consistent exposure to trauma, it shrinks. So therefore, you may be experiencing similar symptoms in the present than you have in the past. So that's part of the hippocampus. The amygdala is wired for survival. When active, it's hard to think rationally. The more hyperactive the amygdala is, the more signs of PTSD are present. It may, in practice, I guess in practical life, it might affect, you might feel anxious all the time, be hard to think rationally on occasions. You might be hyper-aroused or hypo-aroused. Just a little bit about EMDR and memory networks. So EMDR model is a three-pronged protocol. So the first part is processing past trauma that helps to process and heal from past traumatic experiences, reducing the emotional impact and distress. Addressing present triggers, so assists in managing present triggers by integrating them into adaptive or healthy memory networks, fostering healthier emotional responses, and also assists for preparing for future challenges that you might be experiencing. Helps you to form positive memories and strengthen the emotional resilience. EMDR core components. So first part is target memory identification. So the therapy starts by pinpointing a distressing event or memory that needs processing and healing. And theme and connection, that's about the underlying issue or pattern connecting the memories, helping to guide the treatment focus in EMDR. And negative and positive cognition is a harmful belief linked to the memory, self-belief, and the positive cognition is the adaptive or healthy belief developed after processing. When EMDR may not be suitable, there are times when it's not suitable. Could be when you have psychological instability, such as experiencing psychosis or schizophrenia. Maybe you have unstable bipolar condition and may require primary care help. This makes it unsuitable for EMDR until the symptoms are a bit more stable. During active substance use, alcohol or drug use during treatment can interfere with the processing and emotional regulation. Cognitive limitations. This is when there may be significant dementia or intellectual disabilities that prevent understanding of the performing the required bilateral stimulation. Physical and neurological conditions, for example, epilepsy could be triggered by light. If you have eye surgery or severe eye disorders, a stroke, or severe cardiovascular diseases, then it's not suitable. Or you may just not be ready, lack of readiness to process a traumatic memory. Your life might be a little bit unstable at that time, so which could create you feeling overwhelmed. So that's just some examples of when it's considered not suitable. So with EMDR, there are 8 phases. Phase 1 is history and treatment planning. Phase 2 is preparation, building coping skills. I do spend a lot of time in phase 2 building the coping skills, depending on where a person is at and how much treatment or therapy they may have had in the past. Phase 3 is identifying the target and targeting the memory and event to reprocess. Phase 4 is when the bilateral strategies begin, the beginning of eye movements or tapping or whatever the means might be. Phase 5 is installation. What that means is installing a positive belief about the target event or the negative memory. Take that back. Installing a positive belief about the target event that you want to associate with. So a positive belief about that. So the body scan, holding in mind the target and event and scanning for any lingering disturbance. And 7 is closure, assisting you to return to a safe and calm state. And 8 is reevaluating of the recently processed memory to ensure that the distress remains low. How many sessions will I need? In EMDR, there's no one-size-fits-all. Generally speaking, EMDR can require 6 to 12 sessions for a single incident trauma, with complex cases requiring 12 to 24. It depends on your mental health concern, the complexities, psychosocial circumstances. Some people may be earlier the results might be earlier for some people, and others might just take a bit longer. How long are the sessions? Well, my sessions are generally 60 minutes. If you require longer, then you would need to speak to reception to extend that time. What to expect after sessions? With the EMDR session, you can expect that you'll have continued brain processing, which may cause some discomfort emotionally, physically, and some shifts such as dreams, bit of fatigue, and maybe some temporary emotional intensity. Most people feel a little bit mentally exhausted or raw immediately following a session. The reactions should fade within 1 to 2 days, might take a little bit longer for some. Self-care is really important following sessions, with avoidance of significant stress where possible. The long-term benefits of EMDR is that it does decrease the trigger responses, improves your coping skills, and improves self-esteem. In a session, you can see on the image here, there's just some means of an EMDR session, what it might look like. So you can see the lady down the bottom's got her 2 fingers. So mostly in practice, I use the 2 fingers technique. And what that means is we go across from shoulder to shoulder, and you follow my fingers with your eyes. And we do that a few times. And the one above is tapping. So with my sessions, I generally do what I call a butterfly hug, where you will alternate tapping on each side of your arm, and that's a bilateral movement. There's other means that you can use. You can use clickers, and I have a bilateral computer tool, which I'm going to demonstrate with you today. I do not use a light bar in my practice. I know other people do, but I don't have a light bar. Preparation, hierarchy, EMDR, this order is essential to ensure your safety. So first of all, you have to feel safe enough to feel. The next is notice a name. Now what that means is noticing the experiences and sensations that are coming up for you, what's happening for you, whether you're noticing in your body or maybe there's some physical symptoms. Feel and flex, that's what I call a pendulating exercise. We're pendulating between a safe and calm state to some minor discomfort and broadening that window for you. So feeling and flexing, and that may take some time in the process to ensure your safety and just trusting the process. This is just a little bit about window of tolerance. So the window of tolerance is the optimal emotional zone for managing stress and trauma responses, ensuring safety for processing emotions. So in EMDR, the aim is to regulate the emotions, preventing overwhelm or emotional shutdown during trauma processing. So if you're in hyperarousal state and you can't come down, then the aim is to try and get you back to your window of tolerance. Those strategies might be mindfulness and grounding, some breath work to help you get back to your window of tolerance. And the other is hypoarousal, it's the opposite. So where you might be feeling depressed, numb, unmotivated, and lethargic. So the aim again is still to get back to your window of tolerance and broaden that window of tolerance. And strategies could be mindfulness, breath work, or physical activities to help to build that window of tolerance. So now I'm going to introduce you to an exercise called what I call creating a calm and safe state. This is what I call a surfing imagery exercise. I now invite you to just notice any images, feelings, thoughts, or sensations that may arise in relation to the words that I'm going to say. Just take a moment to observe and allow yourself to experience, wherever it may take you. You may experience other images or memories that arise, feelings or sensations. There is no right or wrong. Just notice your process and experience. You can pause or stop any time. And if it's a negative experience, please don't continue with the exercise. So I'll commence the exercise now. Just be curious. What comes up for you when I say feather on the wind, leaves floating down a river, a glisten of snow, a bright sunset, clouds passing by, ocean waves, a gentle rainstorm, falling leaves, mossy forest, starry night, a field of flowers, sun peeking through the trees, ripples in the ocean, the sound of rain. What do you notice? What experiences are you feeling? Just be curious. Are they positive? Is there a memory that comes up for you? What is the image that brings you a feeling of safety or calm? Is there anything that stands out more than the other? Just focus on that. Describe what you see or experience. What emotions are you noticing? What sensations are you having in your body? Just enjoy the moment, enjoy the calm. I'm going to exit the screen and introduce the bilateral tool now. So it won't be a moment. Now bring up the sense of image. Notice what you're feeling and where you feel the pleasant sensations in your body. Allow yourself to enjoy them. Concentrate on those feelings and sensations as you follow the blue dot. Just follow it with your eyes. What are you noticing now? Is it a positive experience? If it is, we'll continue. If it's a negative, please don't continue with the exercise. So for those that have experienced a positive thought or memory, please just continue. What do you get now? What are you noticing? Is there a word or phrase that represents this positive state? Maybe it's a word such as calm, and notice the positive feelings and sensations you are having. Concentrate on those sensations and the word calm, and we'll start the eye movements again, or the lateral simulation again. Take a breath. What do you notice? What are you experiencing now? I'm just going to exit this screen and come back to the slides. Well, I hope that you found some benefit from this exercise. That now brings us to the end of the slides. I'd like to thank you all for watching, and if you have any questions, please don't hesitate to contact our reception staff and also to consult with your GP or medical health practitioner to ensure that you feel safe and that you're okay to engage in EMDR treatment. I'll give you the details of our practice. They're up there on the screen. Please contact us anytime, and thank you, everyone. Take care.